You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about acupuncture. With us, we have an expert on the topic. She's been doing it for 20 years now, Jackie Besinger. Is that right?
Yes. Hi,
Welcome
Randy.
to the program.
Thank you.
Now, you're in San Diego. How long have you been in San Diego?
I've been in San Diego since 1982.
Okay, good. So tell me about your background in regard to acupuncture.
In regard to acupuncture, I went to school. I had my bachelor's prior to acupuncture school.
Okay.
But in the state of California, you need 3 to 4 years of schooling. You pass a state board, and then once you pass the board exam, then you're licensed to practice.
Okay, and you've had your own practice.
Yes.
For how many years now?
Private practice, about 18 years.
And how do people hear about you now in San Diego?
Referral.
Referrals? It's almost a 100%
Yes,
referral?
almost 100%.
Okay, now I'm looking through this list. I guess acupuncture, by the way, has also become mainstream.
Yes, it
Major
has.
hospitals.
Even in military facilities, out at Fort Bragg, in Texas, all over. Yes.
What is the number one thing acupuncture is used for?
I would say back pain.
Back pain?
Yeah, I would say probably 50% of my practice is treating back pain. And then
Really?
neck pain, migraines, sciatica, which is related to back pain.
Okay.
Sometimes elbow pain. I get surgeons with elbow pain, wrist pain, epicondylitis.
What's epicondylitis?
That's kind of like tennis elbow,
Okay.
but people now, they call it mouse syndrome.
Does it work, by the way?
Absolutely.
I can tell you, I haven't had acupuncture. I think 1 or 2 times. I think it was for well-being or something like that. They put some needles in my ears. It wasn't for pain.
Mm-hmm.
But I mean, are a lot of people skeptical? I mean, does it work because it's invisible?
It is. It does work.
Okay.
And the side effect of acupuncture is it makes you relaxed and gives you a sense of well-being. So whether, like in your case, you didn't really have anything to treat, but you probably felt very relaxed and just really nice after you had a treatment.
How long has it been around?
Probably 4,000 years.
And it's Chinese in origin?
Yes.
Is that correct?
Yes.
Now, I always thought, okay, so if you're going to go and get acupuncture, you should probably go to a Chinese practitioner.
Not necessarily.
Okay. And you laugh when. Tell me why. I mean, so.
I've had people come in and say, "You're not Chinese."
Okay.
You know, like, and not want me to treat them. And then I just find that very amusing that people do think that you have to be Chinese to know acupuncture.
But are you a lot better now than you were 20 years ago?
Absolutely.
And if so, why are you better now?
Practice.
Okay.
Practice. I mean, you learn the basics in acupuncture school. And also, I studied with a Chinese master for like 8 years. I was an apprentice, similar to the Karate Kid.
Okay.
And learned his style. He's an aerospace engineer, and he came up with his own style, going back into the ancient texts and applying a technique similar to electronics, like an on-off kind of switch. And he took that and applied it to the acupuncture fields.
What's the hardest thing you think for people to get about acupuncture?
I would say that it works, and
Okay.
to get beyond the whole idea that it hurts. I don't know anything about it.
It doesn't hurt at all, though, really. I mean, I've had it. I didn't feel.
Some people
feel
say
anything.
that it does.
Oh, really?
Yeah, it only hurts for like a half a second, if any sort of mild sensation. But most people agree with you. They say, no, it doesn't hurt. But then there's some people where their pain threshold is very low, and they're very sensitive to any sort of pain. Like if they have a migraine, to some people the pain level may be extremely bad, and to them, to someone else, it may be nothing.
Okay. Okay, so let's talk about back pain for a moment.
Okay.
Have you ever had people that were in a lot of pain, maybe they tried chiropractic,
Yes.
traditional medical doctors, and that with a few treatments, it turns around?
Yes.
Tell me about that. Elaborate.
Two cases I've had. I had a gentleman with 5 herniated discs.
Okay.
Okay. And he was working with a chiropractor, I think actually in Carlsbad, who did decompression kind of treatments on him. And with the acupuncture, he was seeing me twice a week and seeing the chiropractor about twice a week. And within, I would say, 15 treatments, he was completely without pain.
And what's your take on that? I mean, how's it working?
For one thing, it's reducing the swelling around the affected area, whether that's the actual vertebra or the tissues around the vertebra. And then it's allowing the tissues to become back to normal, so that either the disc or the vertebra itself will come back into place. So the two work together
But
really
from
well.
just poking a needle right through the surface.
But I see, I don't do local points. I don't put needles in the back where the problem is.
Where do you put them?
Well, for back pain, I would put them in the hands and around the ankles.
Okay, so let me get this. I've done limited research, and I've had people try to explain this to me. Okay, so this chi for people, and you say that you want to talk to people that really don't know anything about it. So this chi, it's energy going through your body,
Yes.
right? And it gets clogged or blocked up.
Or it can be deficient.
And like the venous system in the body, you have that going on with this energy, and you have meridians, and you hit the meridians, and you're freeing up this energy, kind of like making the energy flow better through your body.
Similar, yes.
Or help me understand.
Imagine that, and this is based on physics.
Okay.
Einstein said we're all made of energy, correct?
All right.
So we all continually have ADP and ATP being produced 24/7.
Okay.
So there's an energy network. Imagine this network that is within us and actually extends beyond the physical form of the body. So these channels of energy that correlate with body systems, with the heart system, kidney, digestion, work together into sort of a holistic systems approach.
Okay.
So that, they affect each other. So what the acupuncture does, and it's a very point specific type of prescription that you would use. So I would use a completely different point prescription for somebody, say, with allergies than I would for back pain, because you're accessing different channels of energy.
Interesting. So somebody with allergies, have you ever had people that are, have allergies and they're fixed?
Yes.
Because you really have. What about
Absolutely.
asthma?
Yes. The same
People that their
gentleman
asthma
with
went.
5 discs.
Okay, but their asthma went away.
Yes.
Have you ever had somebody say that they're off their inhalers?
Yes. The gentleman
that
with the
right?
5 herniated discs.
I didn't expect you to say any of this stuff, by the way. Because I was thinking the problem with acupuncturists, it's so wishy-washy. But you're saying that you're seeing these kind of results.
Absolutely. It's
Really?
exciting. People don't know how wonderful acupuncture is.
I do find it hard to believe, by the way, that people with asthma, people with these kind of allergies, and how many treatments
for actually
that
the
you've seen,
interesting-
like your best cases you've seen? How many treatments for those type of things?
to completely do away with the inhaler, and of
Yeah,
course I work
yeah.
with their doctor on
Okay,
this too.
yeah.
Okay, I don't just say stop doing
Sure.
whatever. Okay, the gentleman with the 5 herniated discs, he was on an inhaler. He had to do 2 to 3 puffs a day. As a side effect, interestingly enough, I wasn't even really addressing his lung issues. I was working on his 5 herniated discs. He said, it's in the movie on my website, actually, where he talks about that. He said, I don't have to do it anymore.
Really?
Yes.
Is he selling any kind of a product or any?
No.
Really? So, and you've had, I'm trying to think of like migraine headaches, fibromyalgia. I look at your list, it's just on and on, snoring, anxiety, attacks, just high blood
Shingles.
pressure, low
Shingles
libido.
is a big pain issue, especially in the elderly. It's very, very painful. And part of that is diet. For any kind of inflammatory or pain condition, I always advise the patient, do not have any of the nightshades like tomatoes, green pepper, coffee, alcohol, chocolate, all those
Okay.
things that
Great.
all those things that taste really good, right? But they cause more heat in the body. So then I kind of switch them to a cooler diet or raw foods that would cool down the body. And I
Okay.
do use a lot of Chinese herbs.
All right. Okay. So if somebody, are you like what do they call them, herbologist or herbalist?
Yes.
Okay. So you have training in that. So if a patient or somebody goes to you, okay, they have problems. They maybe depression, anxiety, asthma, like you mentioned. They go into your office, and we are short on time, believe it or not, about 5 minutes left. What happens on day one?
I have them fill out a very intensive intake
Okay.
about their medical history. I go through all of their medications, and I spend their first visit is usually an hour and a half.
Okay.
And because I really want to understand where this person is in their in their process of dealing with whatever it is. Like I have a new patient that has diabetes, and she's very angry right now. She said, I've always eaten well, and I don't eat a lot of sugar, so why is this happening to me? So there's the emotional component, there's the physical component, and acupuncture and herbs and some change in lifestyle and meditation.
So you have them eating differently. You take care of their emotions. So when they go in to see you, then you address their nutrition,
Right.
like an anti-inflammatory diet.
Correct.
Is that right? You put them on some herbs. You do the acupuncture, and then
We talk about lifestyle.
lifestyle. So you get them past that anger.
Right.
Teach them some meditation. But a type 2 diabetic, are you seeing these people reverse
Yes.
with your?
The first thing I have them do is to drink the juice of a lime every day
Okay.
and do a couple treatments. I usually
Do you get them off bread and carbohydrate?
Yes.
So you get them off like gluten, dairy, all of those things.
Right.
There's a lot more to you than you sent me in these the bio sheet about you. Okay, so combined with diet, exercise, emotional health, then you start doing the acupuncture treatments.
Yes. Usually about the second or third visit is when I'll start the herbal. Not every single patient do I have herbs for them. It's a very specific type of treatment because the Chinese herbs are specific. I have herbs that will address, for example, Meniere's disease.
What about sleeping, insomnia?
Oh, yes. Everybody's stressed out now. So
You have good luck with people that are insomniacs?
Yes, absolutely. We have to discover what is the problem. I spend time with them talking.
They overthink
about-
too much. They overthink too
A lot
much.
of people do. You know, I say, okay, you have a lot of stress in your job? Well, no. I said, what are you stressed out about? Why are you waking up in
So
the
it's
middle of
not
the
just
night?
acupuncture alone? Is it always you're going to look at their nutrition? Always
Oh, yes.
help them with meditation?
Yes.
Do you consider yourself a healer? Because some people are healers and some people maybe aren't cut out for it.
Well, yes. Yes. That's a bit sort of boastful, I guess.
Is it?
It's acupuncture and Chinese medicine and natural medicine in general it's all encompassing of the mind, body, and spirit.
Okay.
So
How much is it, by the way? Typical session?
the first session is $120.
That's low, very low.
I know. I do have packages that will
Okay.
help people, and I do some charity work with the POW group
Nice.
down in San Diego. So I've never turned away a patient because they couldn't pay.
Okay.
I've always wanted
You'll
to
work
help
with them.
people.
So first one is $120, and then after that, what?
If they don't purchase a package, it's $85 for once a week, $75 twice a week.
75 twice a week.
Usually I start people coming twice a week.
Do you ever guarantee your results?
Do I ever? Yes, I guarantee my results.
You do.
Yeah.
Is that
I
right?
usually know after probably the third or fourth treatment if I can help somebody.
Is it mostly nutrition? Could you give me the inside scoop?
As to
And
why
herbs?
it doesn't work?
I mean, when you get results, is it mostly because you're turning around the nutrition, or is it the acupuncture? Or is it the
Depends
placebo
on-
effect?
It depends on what I'm treating.
Okay.
But let's talk about the placebo effect, because I think that's very powerful. Dr. Bruce Lipton, actually, who
I
in
know
medical
Bruce
school,
Lipton,
right?
yeah. He's all over
talks-
YouTube.
He talks about the placebo effect and the power of it, and that more of that should actually be taught in medical school. And he ascribes the placebo effect as the cure for at least 1/3 of all illnesses. So
Okay.
I believe that the placebo effect is our own healing ability, and what acupuncture and what I want to do is to teach the body how to do that.
That's why I say, I said some people are healers. Some people could lay hands and it's their faith. Even Jesus, he didn't take credit for healing people. He said it is your faith that healed you. And do you think, though, that when you're with somebody, you may get better results than others because of your belief in them getting better rubs off on them at some point?
I believe that each person has that ability.
I mean, do you have to be ready for acupuncture, I should say? I mean, can a skeptical person go in and
Oh,
say,
yes, absolutely.
because they say it could work on animals as well.
Goldfish. Koi, they do get acupuncture.
Really?
Yes, I don't know how it works.
That's probably why they're so big. That's probably why they get so big, is the acupuncture.
all that chi moving around, right?
So you believe in this chi then? It works.
I believe in
People
it
are getting
because
better.
It's real.
50% placebo? Placebo meaning the mind, and that means if your patients can believe they're going to get better, okay, the body sends out this healing force, plus with the acupuncture, freeing up this energy source.
I would say 1/3. I'd say 30% is placebo. But that's their own healing ability.
How much in the hands of the practitioner? in your opinion?
I think the
As far as
acupuncture,
results.
it has to be good.
Really?
There, you know, it's true in anything.
How do you choose an acupuncturist? They're licensed? How do you know if you get a good one?
Well, I think if you go to the websites now, you can go to Google acupuncture and you look at the years of experience. I think that's one thing. And the style of acupuncture I practice is the balance method, which I find for me is very, very effective. The style that I learned in school that I had to pass the state boards for is called traditional Chinese medicine. And for me, that was not as effective as the balance method, and I'm a very results-oriented practitioner. So for me, that works the best.
Insurance looking at any of these things, by the way?
Oh,
Yet?
yes.
So they'll reimburse some of this?
Several will.
Is that right? You'll work with them. You know, I have a list of questions for you. And you know, we're out of time. But when you were driving here and you said, you know, and you're thinking, I want people to know this about acupuncture. Yes. What is it?
It works.
It works.
I would try it for everything.
For pain relief, insomnia.
Infertility.
Infertility.
Yes, male and female infertility.
You think you're one of the best? I mean, secretly, really?
Yes, I do. I think
You do?
I am one of the best.
Do you have people that say, I've been to other acupuncturists?
Yes,
and
several times.
Really?
But I really want to get the word out about acupuncture because it's so cost effective and efficacious in compared to it does no harm, which is what a doctor's supposed to do.
What's the easiest? I mean, if you had to pick a problem, and we are out of time, but you said, boy, this is easy to treat. I get great results with blank. What problem, malady, disease state do you get great results with? Is there anything you get better results than others?
I would say generally just a strain, like a strained back, strained neck.
And that's the part I have the toughest time to believe. Without chiropractic, without stretching, can you do it, or does it have to be?
If you add that, I would.
I'm saying without that, can you do it?
With no chiropractic, I can still do it. It just takes longer.
Okay.
But a strain or a sprain is fairly easy.
Easy.
Yeah.
Okay, great. Final message is somebody that's skeptical about acupuncture, and they have some of these problems.
I would say absolutely try it.
Just try it.
Give it 5 visits.
Give you a call.
Yes, absolutely. Give me a call. I have a package of 6 visits. The first visit plus 5. Most conditions, even herniated discs, I can treat in 10 to 12 treatments.
Are you ever surprised with the results? Like you're saying, boy, I didn't think it was going to.
Yes.
Give me an example.
Shingles.
Really?
Yeah. Sometimes I've had patients that within like less than 10 treatments, they're completely better.
But they're also taking medications for the shingles as well?
Sometimes, but not all the time.
Some people go no meds and get rid of the shingles.
Yes.
But isn't shingles one of those things that kind of works itself out anyway?
In shingles, there's a condition called post-herpetic pain. And what that's almost worse than the actual pustules and the itching,
okay,
that you have at the beginning of the shingles. That pain is worse.
Do medical doctors send you patients or clients?
Sometimes. But I often refer out to chiropractors, to psychotherapists, depending on the level of anxiety or depression that I'm dealing with. And I refer to MDs, and sometimes MDs refer to me as well.
You walk your talk, by the way?
Yes, I do.
Do you get it? You get the
I do
acupuncture?
Qigong every day. I usually do.
You teach Qigong, right? What is Qigong exactly?
Qigong means the work of the Qi, and actually acupuncture is a formatted Qigong.
Okay.
Because we're all energy. So what the Qigong is you're allowing your energy to work. It's like a focused breathing exercise, similar to Tai Chi.
Okay. Can you see when somebody's energy is off? You have a lot of experience. Can you?
Yes.
Like blocked energy?
Mm-hmm.
What do you think of my energy?
You have good energy. You seem to be really healthy.
Okay. No blockages that you can see? Because I have a tough time sleeping sometimes.
That was the only thing.
Okay.
There's some kind of, you're not filming right now, right?
Yeah, no, I am. Go ahead, tell me.
Just a little, I would say a little worry, a little stress, concern.
Okay.
But other than that.
My only worry is whether I'm going to believe any of this that you were, and I do. You've sold me a little bit. So I want to thank you for coming to the show. Very good, very good.
Thank
and your
you.
website is what? What is your website?
Vibrationalhealingarts.net.
Good. You know, we'll have you back next time now that I got to know you a little bit, and we'll focus on one small topic.
Okay.
And we'll really hit that topic hard. But thanks again. If you watch the Wellness Hour, I'm Randy Alvarez. I wish you good health.